you can tell us about your. I haven't done my research, my homework.
That's okay. So,
please pipe your own horn.
Yeah, you know, if you go through like a long bio about me, and I'm a storyteller, and so I tell things through stories. So I think by the time I finish, you're going to know who I am just by virtue of what I do, which I think is a lot better than. I mean, does anyone really care that I went to the University of Michigan?
I do. Go blue.
Yeah, all right. They were playing Iowa yesterday or this weekend. Oh, did they lose? Oh, they did. Oh my gosh. Well, they lost the previous week too.
We stopped talking about it.
Oh, okay. Yeah. It's not that I'm not, a loyal mom. I give them money and all that, but that's probably less relevant than what I'm going to talk about. So I teach the policy courses here, and I've been avidly interested in public policy writ large, health policy specifically, for years. And I had the privilege of being able to work in Washington on a number of occasions on various parts of healthcare policy and health reform. So it's fun to be back there. The American Academy of Nursing has a new policy fellowship program with the AARP, and they called me at the end of November last year and said, you know what, we're screwed. Like, healthcare reform is rolling down the track really fast, and we just don't have anybody that can be helping us think through the issues and how to position nursing, what needs to go on. I mean, this is a locomotive that's taken off. And if any of you guys, by virtue of being here, are interested in health policy, let me tell you, you will be gainfully employed for the rest of your lives if, as a healthcare provider, nurse, whatever, you really get policy and get engaged in it. I'm telling you, in nursing, we can all count on, one hand, maybe 1.5 hands, the number of nurses that really get and work hard in health policy. There's so few people that do this. We all know each other, we're all on the same panels, because we haven't really built. No one built our generation of it, so I'm passionate about building the generation to go forward and do this, because there's so much that needs to be done, which is why I got the phone call saying, because they know that I've been doing policy work for years. I was MedPAC, this new Medicare commission that they're talking about. I worked for them. I worked on Capitol Hill in the U.S. Senate as the first year of the Clinton administration. I was on the Hillary Clinton task force, so I went around health reform last time and have had a lot of experiences. So they asked me to take the fellowship. So I'm in Washington half of the week, Tuesdays and Wednesdays, sometimes Thursdays as well, working on health reform through the American Academy of Nursing and AARP. It's very interesting. When you work in nursing organizations, a lot of interest, but they're very, very small fish in a big pond, not much money. You go to AARP, the big guns. I mean, these guys really can throw their weight around. So it's kind of fun. You go on Capitol Hill and you say, I represent, the nurse practitioners. They're like, others are nice. No, it's not good. It's like AARP, come on in. So, not bad being part of 39 million seniors. So, yeah.
I just have a question about that. If nurses are the largest number of healthcare professionals, if we encourage more political involvement in, at every level, isn't there the potential for nursing to be huge?
Yes.
Force?
Yes. They could be much huger than they are. Much huger. It has not been a lot of lip service in organizations have been given to true engagement. It is not a small task. You decide whether to do it or not. Here's a perfect example. The American Medical Association has organized a coalition of groups called the Scope of Practice Partnership. This American Medical Association working in each one of the states that has scope of practice legislation currently, i.e. keeping us, nurse practitioners, as well as chiropractors, social workers, all of them, in check. They are monitoring all the legislation that's going on and have organized teams to make sure that none of that legislation passes. We are now investigating restraint of trade, but nonetheless, all right, that's what it takes. Now, physicians make much more money than we do. They contribute heavily to political action and as well as policy work, and it pays off. We've got many more of us, so it takes fewer dollars per person and enough effort to really try to do these things. But we have not really done more than, I would say, pay it lip service. It's fortunate that nurses, in many ways, are still seen as the most trusted and valued among all healthcare providers. When you're up on Capitol Hill, you have street cred just by being a nurse. There is something to be said for that. That is not a small thing. It is important. But we could be much more effective. And when you look at the legislation that's come out, no, the physicians are front and center. In fact, I was just advising someone in the American Association of Medical Colleges as a new piece that they're trying to ram into the health reform bill. They went to the American Association of Colleges of Nursing and have asked them to endorse it. And I said, look at the legislation. It says that, it has to be a teaching hospital. That's the anchor of this community team. Well, why can't it be a nurse-managed center? Why can't it be a federally qualified health center? Why can't it be a community center that's run by nurses? I said, you don't sign on until they change the language. Use your power. All right, you want my logo? Here's what it costs. If you don't like it, take it someplace else. And that. I said, you got to trade hard. What are we talking about? You think they're going to play nice? Great. We are a value where you don't. And if you have street cred, play it smart. But in health reform, there had been a lot of concern about just where the various professional groups will be able to play a role. No one's speaking about physicians. In December, I met with, there was a small group of us that met with the leadership team for now the late Senator Kennedy. But Senator Kennedy was the head of one of the two committees in the Senate that was responsible for writing health reform legislation. And we met with them, with John McDonough, who's chief of staff, to talk about health reform and where the efforts were currently going on. And much of what you're hearing in the news about health reform is around two issues. Who are the uninsured and how are they going to be brought in? What vehicles are we going to use to bring them in? That's where public option and all of that stuff comes in. And the second big issue is where is the money going to come from to pay for all of it? You have 47 million people who don't have insurance. We're not even talking about all the people who are going to come off of COBRA and are going to flood those numbers. Right, so we have a large number of people who do not currently have insurance. All right, if you bring them in and they start losing as a result of being covered, how are you going to pay for that? How are you going to pay for the premiums? How are you going to pay for the health care services that they need to use? There's that part of it. That's where most of the noise and most of dialogue is going around. And they use a lot of arcane terms that nobody understands. But you'll get it as soon as I finish. The issue that is absolutely more important than either one of those, without question more important, that is not getting airtime, but where you can play, every one of you, the most important role is what are we doing with that money?